Hi, welcome to Healthy for Life. I'm Dr. Scott McCann, the Director of Health Education with the Santa Barbara County Public Health Department, and this is my wonderful co-host.
Oh, thank you. Rose Davis, also with the Public Health Department. Healthy for Life is about promoting healthy behaviors and preventing health problems. In today's show, we're going to take a look at AIDS and HIV transmission and prevention. We're also going to take a look at a conversation, something I'm really looking forward to, a conversation that Scott had with a woman who's been living with the disease for 12 years. And I can't imagine the strength and endurance that must take, so I'm really looking forward to hearing that, Scott. Now, those of you who are regular viewers of Healthy for Life, you know that we always have experts and professionals in to talk about the current health topics and issues for that episode, and today is no exception. Our own Dr. McCann is the overseer for our county AIDS programs, and Scott is also co-chair of the SBC HIV Prevention and Care Council, something that I did not even realize, Scott. That's great work. Mm-hmm. So I'm really looking forward to learning about HIV and AIDS. I'm ashamed to admit, even though I work for the Public Health Department, there's really a lot that I don't know. So I'm hoping that you'll enlighten me as well as our audience today. Well, why don't we start with just the basics. What is HIV and AIDS, and why is it so serious?
Well, HIV is human immunodeficiency virus. It's the virus that invades our T cells, which is a critical part of our immune system that fights other infections, and not only kills those T cells, but takes them over and starts reproducing more of the virus itself. Someone is diagnosed with AIDS, which is acquired immune deficiency syndrome, when either their T cell count drops down to 200 or below. Normal T cell count is about 800 to 1200, so you can see it's very low. And you get one of these called opportunistic infections, where you can't fight a disease that normally you could fight off, like pneumonia, but because your T cell count is so low, the pneumonia can become lethal, and many other diseases. So people often will die from these other secondary infections, but are caused really by the HIV virus.
Oh, I see. I understand now. And how common is it?
Well, we've seen leveling off a little bit, although way too many new cases. There are about 500 people who have died in Santa Barbara County from AIDS, and about 500 currently living with AIDS or HIV, so a total of about 1,000 cases in Santa Barbara County that we know of. Now, there may be many other hundreds more cases we don't know of, because if people don't get tested,
sure.
We don't know they have it, they don't know they have it. Right. You can see nationally, we've got over 1 million HIV cases, with about 500,000 people having died in the U.S. from AIDS, with a little over 1 million currently living. And then worldwide, 58 million cases, and these are estimates, but pretty close. 25 million people have died from AIDS, and about 33 million people living with AIDS. Mm-hmm. And of course, the new cases down there on the bottom of the screen, about 30 in Santa Barbara County, again, that we know of each year, about 57,000 in the US, and over 2 million now internationally. So this is an epidemic, a pandemic, that's probably the worst epidemic in our lifetime.
Oh, wow, that is serious. So how does one contract it?
Well, still sexual transmission is the main way that people get it, through sexual activity, through blood products. It's in the bodily fluids you can see on the screen are that transmit HIV are blood, semen, vaginal fluid, and breast milk. So any behavior that exchanges those from one person to the other can transmit the virus. So sharing needles either for injection drug use or piercing, that kind of thing, tattooing that aren't clean needles, sexual intercourse, any penetrative sexual activity, and breastfeeding, of course, with breast milk, but also during pregnancy or birth, a woman can pass if she has HIV, she can pass it on to her infant. And this is why it's so critical that pregnant women get tested for HIV.
Oh, sure.
Because if the doctor knows they have it, they can take some medications that will really reduce the likelihood that the baby will be born with the virus. So definite message is, get tested if you're pregnant.
Oh my gosh, yes.
Have never been tested for HIV or not recently.
Right. Yeah, and I saw in the intro that it said it could reduce the possibility of giving it to the baby to less than 1%. So I would think that that would be hugely important.
Very.
So you're talking about transmission and how people catch it, and I know that there's a lot of misconceptions out there and a lot of myths. So tackle these if you can. Can you get HIV from kissing?
No known cases of transmission. There's a little bit of HIV in saliva, but so far no known cases of transmission through kissing.
Okay. What about if you're using someone's cup? Again, you're talking about saliva.
Yeah, generally no known cases. We call all of those casual contact,
Okay.
day-to-day type interactions that people have. And so far, there's been no evidence of HIV transmission. So that's the good news. Of course, it would be much worse if it were spread more casually than through sexual activity and so on. But the good news, people don't have to worry about those day-to-day activities.
Okay. And here's one, and I don't mean to sound gross, but I know people ask this sometimes. What about a toilet seat? You go into a public restroom. Do you have to?
No, you should be good. You may want to wipe it off so it's relatively clean.
Use the little covers that they have if they
right, but
for
not,
a variety of reasons.
Right,
I guess you'd
not,
use that.
but not HIV. Yeah.
All right, so we had, earlier I was saying I'm really interested in the trends that are in Santa Barbara County regarding HIV. What can you tell me about that?
Well, sexual activity is still the most common way people get the infection. Men with men having sex with men, still the most common source of new cases. Although we've seen an increase in heterosexual transmission, particularly among Latinos in North County. And the way that can work, one way it works is if somebody has HIV and doesn't know it, they haven't been tested, they might have gotten it through needle sharing or sex with sex workers or possibly occasional sex with another man. It's usually men who then give it to their wives or partners through sexual activity in their relationship if they don't use condoms, haven't been tested, and so on. So we've seen an increase among Latinas in North County. Sometimes they don't know until they're pregnant and do get tested, and that's when we find out they have HIV.
Gracious,
and
okay.
Better late than never, and then they
Right.
can start treatment. Like any infection, the sooner you find out and the sooner you start treatment, the better your chances of survival. And there's no cure for AIDS, but the medications can help pretty dramatically.
And you
Good bit
mentioned-
of news,
good.
before I go on, is the reduction in transmission through needle sharing thanks to the injection drug use syringe exchange program that the Civic
right.
Pride
Yeah,
Foundation
that's a great
operates.
program.
And it was the second leading cause of transmission until about 2000 when the Board of Supervisors passed this rule that would allow people to trade used needles for clean ones. And that,
Right.
not just in Santa Barbara, but around the country and world, has helped reduce HIV transmission significantly.
Yeah, I mean, that's needles, relatively speaking, when you're talking about this epidemic, are relatively cheap, really, to have that program in place. I think that's great. And then you were also talking about other ways that people can prevent getting HIV. You mentioned condoms. What are some of the other things?
Well, abstinence, sexual abstinence, and related to that, monogamy. If both partners are truly monogamous, I think what happens, unfortunately, is sometimes in a married or committed relationship, one person might say they're monogamous, but if they have sex with somebody else and don't use condoms and then bring it home, that's how it can transmit to the spouse or partner. But latex condoms, we highly recommend because they're they're the most effective. The lambskin condoms actually have tiny pores that can let the virus through because viruses are so tiny. So if you're allergic to latex, which a few people are, there's a polyurethane condom that also is good. So either latex or polyurethane. You want to use water or silicone-based lubricants because oil will eat through a rubber condom, a latex condom, very quickly. And in my classes, I demonstrate by putting a little hand cream or a chapstick or anything with oil in it, petroleum product. And within seconds of putting it on a inflated condom, it'll burst and eat right through the rubber. So
Really?
oil and rubber just don't mix.
They don't mix. Okay.
Yeah.
All right,
So,
that's good to know.
so you want water or silicone-based lubricants for sexual activity. Lubricants help also because if a woman's vagina is dry during sexual activity or during anal sex, a man or woman, it'll cause these micro tears, tiny tears in their anus or vagina, which allow the virus to get in much more easily. So lubricant can help reduce that kind of small tears and not only make sex feel better, but make it safer too. So those are some of the things. We mentioned using clean needles, limiting the number of partners you have. Having sex with fewer people obviously reduces your risk of exposure. And limiting drug and alcohol use because people get drunk or high and they make poor decisions about safety and sexual activity.
Okay. I was wondering why that one was up there.
So,
okay.
so all of those
that's
are good
true.
prevention steps. Yeah.
Right. Oh, that's great.
Yeah.
All right, so I'm doing my best to make sure that I don't get HIV, but how does one know if they have it, and how do they prevent it from spreading?
Testing is really important, and there are 3 types of HIV tests. There's a urine test, a blood test, and an oral swab, which is great. It's the rapid test. You can get your results in about 20 minutes. And any and all of those are good to do, again, before you have sex with a new person for you and your partner.
Yeah,
Very,
it's just
very
being
important.
considerate, absolutely.
Yes,
Yeah, saving
taking care of
lives.
yourself.
So you mentioned these tests. What other services are available for people?
Well, we're lucky in Santa Barbara County, a lot of great services both for people who have HIV or AIDS and people trying to protect themselves. So you've got Pacific Pride Foundation's the biggest provider of services for people with AIDS or HIV. They have a food pantry, the Necessities of Life program. They run the syringe exchange program. They do testing. You've got neighborhood clinics, Santa Barbara Neighborhood Clinics that does testing. The Council on Drug and Alcohol Abuse does testing and outreach. The Public Health Department clinics, we provide services to people with AIDS and HIV and limited testing. Planned Parenthood clinics in Santa Maria and Santa Barbara do education and testing. And then you've got Sarah House and also Casa Esperanza, the homeless shelter, that all provide housing services for people with AIDS.
Wow, great organizations, and good for them.
Yeah, we're lucky to have all that available.
Yeah, we really are.
And you mentioned at the beginning a woman I spoke with who has had HIV for about 12 years. Her name's Catherine Bertalin, a wonderful woman. She's a mother, a grandmother, a bookkeeper by trade, and an advocate for people with HIV, but also people with mental health needs. And I got to interview her the other day about her life with HIV, and here's what she had to say.
Great, thank you.
Well, hi, Catherine. Welcome to Healthy for Life. How are you doing?
I'm doing great, Scott. It's nice to see you.
Good
Always
to see you.
nice to see you.
Yeah. So we're going to jump right in, and if you could tell us when you were diagnosed with HIV and how you found out, that would be interesting.
I was diagnosed on the last Monday in April 1998. It was a beautiful, beautiful day. I was really excited about moving on with my life. And unfortunately, when I get the results of my HIV test, it was positive.
Now, what led to you getting an HIV test?
Interestingly enough, the reason I had an HIV test was to upgrade my life insurance policy. It had nothing at all to do with considering I may have HIV. I had no thought that I was engaging in risky behavior.
So how did you react when you found out?
It was shocking. I sat in the office of the counselor for 3 hours and cried.
I can imagine.
He was worried about letting me go. And it was very, very traumatic because, as I said, I went to get a life insurance policy, proof that I don't have HIV.
Now, did you realize how you were infected once you found this out, or you weren't sure, or how did you figure that out?
I pretty much knew because I'd been in a relationship with a man, an unprotected sexual relationship with a man for 4 months. Immediately prior to that, I had ended the relationship, but this was the only way I could have been infected.
Now, had you felt sick prior to getting diagnosed?
That's a good question, and it's a really interesting answer because I had the classic textbook symptoms. I've met a lot of people since then, but I've not met anyone who's had these symptoms. I had the classic flu that put me in bed for 10 days, very, very, very ill. and a rash on my body. And those are the classic symptoms, but interestingly enough, most people don't have any symptoms at all, or if they do, they have a very mild flu, and people wouldn't associate that with an HIV infection.
So did you just think you had the flu or some relative, not a serious infection?
What the doctor said was literally I had a flu or a virus that was attacking every part of my body. That was the long and the short of it.
Wow. So once you found out that it was HIV and you had these suspicions about who infected you, what did you do?
Well, the first thing I did is I went to a local HIV doctor and was retested. And of course I had HIV. And then I reached out to our minister because I was infected by a man I'd met at church. As I mentioned, I had ended the relationship. I was actually not getting along well with this man, so I needed an intermediary. So I went to our minister and I asked him to intercede for me, and he did ask the man to be tested. The man was tested and of course was diagnosed with HIV also.
Did you talk to him, or did he say he was sorry?
Oh, no. He actually accused me of infecting him, which was impossible. And as a matter of fact, I reported him to the district attorney.
Wow.
Because I already knew that he was having unprotected sex with at least 3 other women in Santa Barbara, possibly more. Well, the reason I ended the relationship was because of abuse. And I reported him to the district attorney, not for anything that could be done for me or on behalf of myself, but I knew he was still having unprotected sex with other people. And I reported him to the district attorney in order to protect other women.
Now, my understanding is it's a felony if you knowingly have unprotected sex with someone and you know you have HIV. So did he stop, or did they stop him, or what
The
happened?
district attorney called him into the office and told this man what I had said, named the names, and told him that if he was ever named as a future source of HIV infection, he would be arrested and prosecuted for committing a felony.
Wow.
He was, of course, very, very angry at me. Our situation did not improve. I ultimately needed to hire an attorney to protect myself from him. I have no idea where he is.
So then did you begin, was the medication available then, the cocktail that's available today, and how did that go?
Yes. In fact, at the time, again, this was 1998, at the time the theory was to start people newly diagnosed on the medication immediately. So 30 days later, May of 1998, I started what's called triple cocktail or highly active retroviral therapy, and immediately I became very ill. Just as I reacted very, very symptomatically to the virus itself, I reacted very strongly to the medication. And I spent the next 16 months battling horrendous symptoms, side effects of the medication, to the point that I was actually suicidal. And after 16 months, I went down to UCLA, and the doctor with whom I spoke said, well, it's really quite simple. The medication level is too high.
So they lowered the dose? Or?
Yes, and I've had my HIV medical care through UCLA since 1999, very successfully, and I'm able to take a lower dosage of HIV medication, which is not common. It's really not common at all. It's considered quite risky.
And how's your health been recently?
My health is excellent.
That's great.
Quite excellent, yes.
You look good and you seem healthy. And
Thanks.
I know that's one of the messages that we try to get out there, and you try to get out there as a speaker, is that you can't tell by looking at somebody if they're HIV positive or have any number of illnesses. Is that true in your experience?
Yes, and I'm glad you asked me, because that's a key factor. It's a very, very important factor to keep in mind. A person with HIV generally doesn't show symptoms, and that's dangerous. Now, consider this. If I had not gone to get an HIV test in order to upgrade my life insurance policy, I would have continued having unprotected sex, and I had HIV. So I would have been out in the community infecting people. That's such a chilling thought.
Yes, yes.
So a really important message for young people or anyone who's dating. When a relationship starts, when it becomes serious, when people are starting to think of having sexual relations, it's paramount. It's vital that people protect themselves. we can ask each other, do you have HIV? The answer is probably going to be no, but that doesn't mean it's true.
Right.
And we're not trying to fool someone, we just haven't verified that.
Right, they may not know. Yeah.
So a good rule of thumb is when you start dating, I know this sounds terrible, but assume the other person has HIV. Just make that assumption.
It's a safe way to go. Yeah.
Protect yourself with condoms, and as the relationship matures, have an HIV test done together. Make it a date.
Sounds like
Chocolate
a nice
sundae
approach.
and an HIV test.
And you're right, it's not an accusation. It's saying you don't know, unless they've been tested recently, they don't know, you don't know. And if you do it together, it's more of a
Right.
mutual thing. So that's a great suggestion. Let me ask, if I can, in your case, did you know about HIV? Did you consider using protection? Because you've said you had unprotected sex with the person who infected you. We also earlier talked about barriers to condom use and getting tested. And it's difficult. It can be embarrassing. It can be awkward to talk to people about. What were some of, and then you mentioned abuse, and that can be a factor too. What were some of the barriers in your case to using protection or protecting yourself?
The biggest reason and the barrier is simple, low self-esteem. I had such low self-esteem that I literally did not know how to protect myself as a woman. I did not know how to protect myself as a person. And I use the word protect because this was a man who was abusive to me sexually, emotionally, and psychologically. And I allowed 4 months of frequent sexual encounters to happen without a condom once. We never talked about condoms. I never provided them. He never had them. So we had lots and lots and lots of opportunities for unprotected sex. And when I talk about low self-esteem, I was not looking for this relationship. He approached me. I was quite flattered. Low self-esteem. I'm really flattered.
To have him interested
To have him
in,
interested
yeah,
in me.
yeah.
We started having unprotected sex within 24 hours of even dating. Again, very low self-esteem. These are not wise choices. But because of having unprotected sex and developing symptoms very quickly, within 2 weeks of having unprotected sex with him, I had these symptoms, flu-like
wow.
symptoms and a rash. I was very ill. But again, I didn't have a clue that it could be HIV. My doctor didn't say anything. I allowed the abuse to go on. I did not want the relationship to end.
Sure.
As abusive as it was, as painful as it was, because of low self-esteem, I didn't want to be left alone. So here's another really important factor. Please, everyone, take care of yourselves and take care of your partner. It's a two-way relationship. It's not just one person.
And if they don't care about your well-being, that's a sign that something's out of whack or out of balance.
Correct.
You'd think.
Yes.
What have been some of the other challenges living with HIV? You mentioned medication side effects, the challenge actually of protecting yourself. What else has come up in your life that's been challenging?
I think the biggest challenge literally have been the side effects of the medication. The medications are extremely toxic, and their only function is to destroy the virus. It's not meant to help us feel better, look better, or even to protect the rest of our body. The medications destroy the virus, but in the same time, they're also slowly destroying different parts of our bodies. Some of the medications can cause kidney failure. Some of them can cause heart attacks.
Ooh.
Over time, my major side effect is called lipodystrophy, which is the redistribution of body fat. Also, profound fatigue. There was a time when I was taking certain medications that I literally was in bed any minute that I wasn't working.
Wow.
That meant I got up and went to work, came home and went to bed. On the weekends, I was in bed. Profound fatigue, rashes, hemorrhoids, certain types of cancer.
Wow.
Profound fatigue, digestive problems, severe digestive problems. But today, I take 3 pills once a day. I used to start taking my medication at 4 in the morning.
Oh my gosh.
And I had to take some of them either 2 hours before or an hour after eating, and others with food. So many of us were taking multiple pills off and
Throughout
on
the
all
day,
day.
yeah.
Now I don't even
That's
even think about having HIV. I honestly don't. I go through the day, there's no reminder
We've
of
come
it
a long
for
way.
me.
Yeah, yeah. Well, and I'm glad you mentioned that because some people think, oh, there's a cure for HIV, and there's not a cure. There's medication to
Right.
help keep people alive,
Right.
which is wonderful. But I know it doesn't work very well for some people. They're resistant to the medication. Side effects you've talked about. So I think while the medication's been a huge step forward, it's still not something people want to get and tolerate with these side effects and so on.
And that's a really important point to remember, because as I speak to college students and high school students and junior high students, I let them know that even though we have medications that are relatively simple to take, no one should be denied the medications. They are available to everyone in California, whether through private insurance or local counties or through a federal drug program. They're available, we can take them, they're easy now, but that doesn't mean that's still all good, because as I mentioned, they're toxic.
Yeah.
I was infected when I was roughly 45. I've had my children, I'm a grandmother, I'm on the other side of a very active life, but for young people, let's say someone who is 18 or 25 or even 30, newly diagnosed with HIV, that person is going to be taking that toxic medication for a long time. So that's another point I try to make very strongly. If self-preservation isn't enough of an issue, just think of what taking that much medication over a period of time will do to one's body and brain and stamina.
Yeah, yeah. Well, you're on the kind of final point I wanted to ask about, which is advice for young people, older people, anybody, to help prevent the spread of HIV.
Actually, I'm glad you asked that question, because one really, really important point is I really believe we can stop HIV right now, today. I don't know what time it is, but as of right now, we can stop HIV. HIV can be stopped if everyone practiced safe or safer sex, which means condoms, if no one shared intravenous drug needles, we would stop HIV. It's that simple.
Isn't that amazing? Yet it continues to spread, and the epidemic continues. But and that's why we're doing this show, and that's why having you speak and talk about some of the real challenges in people's lives that they face, and ways to overcome them. And I've known you for several years now, and you're such an assertive person and such a wonderful person, getting the word out, helping build up other people, and say, you're a good person, you're worthwhile. Take care of yourself, and I think that's the theme we want to leave people with. It's so powerful. Unfortunately, we don't have much more time, so I want to thank you for coming and being on the show. And people can contact me at the county if they're interested in having you come out and speak to their group, because I know what a wonderful speaker you are.
Yes.
So thank you for being here.
You're welcome, Scott, and it's my pleasure.
Okay, thanks.
Wow, that was something, Scott. And Catherine, such confidence. I mean, perhaps you had started out with low self-esteem, like you had mentioned, but the work that you're doing, I'm really in awe of your courage and your confidence. So that's great what she's doing in the community. I'm really impressed.
Amazing woman, yeah.
Yeah, and such simple key points that she gives us, that it could be stopped just by simply preventing the spread. Wow, so that was great. Well, thank you, Catherine, for that. That was awesome.
She's great.
And as Scott mentioned when he was talking to Catherine, you can contact the County of Santa Barbara for services regarding AIDS, HIV, or any other of the health services that the County of Santa Barbara provides. The public health website is, again, for your information, is www.sbcphd.org.
Absolutely, and you can call me at my office, 681-5270, if you have any questions or concerns. And that's about it. We appreciate you joining us, important topic.
Yeah, and thank you, Scott. You really taught me a lot.
Oh,
So and taught our audience a lot too, I'm sure. So thank you for that, Scott.
All right.
All right, folks, that's it for today. Thank you.